About 55% of cancers diagnosed in women and 25% or 24% of those diagnosed in men are influenced by weight, according to the Centers for Disease Control and Prevention. In fact, good nutrition, maintaining a healthy weight, and exercise are one of the most important ways that you can help lower your risk for more than 10 common cancer types, including breast cancer, which affects about 1 in 8 women in America. Hi everyone, I am Deanna Squires, Enloe's Community Outreach Coordinator, and today we're here celebrating Breast Cancer Awareness Month. I'm joined by Dr. Lydia Schrader, Medical Director for Enloe's Comprehensive Breast Care Program, and Rebecca Senoglu, our Cancer Care Program Coordinator. Cancer Support Program Coordinator. I knew I was going to mess that up. I got it. We're going to be talking about the correlation between obesity and breast cancer. One of the things that we are doing this year is our cancer program has adopted the education around the correlation between obesity and cancers as our prevention goal for 2018. And we are asking people in the community to help share their feedback and knowledge on this subject. And today we're doing that through a very brief survey that we are going to post a link to in the comments at the end of today's session. And so we would really encourage you to take just a couple of seconds and answer 3 short questions. Three questions. And provide
yes or no. You don't have to type anything.
Right? It's not even like really a pop quiz. It's more just like, did we teach you
it'll
anything?
work though. We're very curious.
Yeah. So. And as part of that, the incentive, we're going to be talking about some resources in the community to help people, and we will provide a resource sheet in that survey. So just something to remember and a little teaser for later in today's conversation. As always, we do want to remind you that the information we're talking about today is not intended to be medical advice. We're going to share a lot of great information, a lot of great encouragement, but if you do have specific questions about your health, about cancer, signs, symptoms, about weight and weight loss, please do reach out and talk to your healthcare professional because they are a really great resource for specific information. So with that, Dr. Schrader, before we get into talking about obesity and cancer, let's talk about breast cancer. What is that? I mean, we all know, we all have probably been affected by people who have had cancer or know of people who have, but tell us just a little bit more about breast cancer and signs and symptoms and things of that nature.
So breast cancer is the most common breast cancer in women short of skin cancers. And a lot has been made in the past about self-exams and the importance of self-exams, and that has caused a lot of anxiety among women. There are other studies out there, the biggest one from China, that actually showed that breast self-exams by women themselves has not really impacted breast cancer identification, survival. So we've adopted sort of a different term, which is breast awareness. And it really isn't about the patient diagnosing their cancer. It's about you just getting to know your breasts. We all take showers. We can all stand in front of a mirror and take a look. And when you're in the shower, your hands are soapy. It's a good opportunity just to run your hands over your breasts and see if there's something different. We're looking for changes in the shape of the nipple. Is it retracting? Is it pointing in a different direction? Any skin change, redness, dark spots, dimples, dents, change in the shape or size of the breast compared to the other one. Running your hands over, are you feeling a lump? Are you feeling an area that feels different? Any discharge, nipple discharge, any lumps under the arms? If something like that occurs, it's different to you, that's when you bring it up with your primary care provider. Let them assess you. It's our job to help you either find the cancer or reassure you that it isn't.
I think it's so good. I love the term breast awareness because it is really just knowing our bodies and recognizing if something changes. Mm-hmm. And so it kind of takes the pressure off of, what are the signs and what are the symptoms? It's just knowing you. Who am I and how am I evolving or changing? So I love that. I think that's great. So Rebecca, let's talk now a little bit specifically about obesity. So what is considered obese and when does that become a concern?
Well, obesity is when somebody has an unhealthy amount of fat on their body. And the most common way to assess that is by calculating a person's body mass index. You know if you're obese by looking at your BMI. And to calculate your BMI, you divide your weight by your height and you square it. But if you're intimidated by the math, which I have to confess I am,
Most people
yes, there are very, very easy BMI calculators online. I think they're going to put a link to one in the comments. So you can calculate your BMI, and the BMI cutoff, anything above 30 and above is considered obese, and overweight is 25 to 29.9. And so calculate your BMI. It's a better way to determine, how you're doing than just looking at your pounds.
Right. It kind of gives you a baseline.
Yes, yes. And don't be surprised if you fall into a range different than you thought, because a big part of what we're realizing with this campaign, what I've learned, is that we're all skewed in our understanding about weight. Dr. Simchek at he's a bariatric surgeon, gave a great presentation last month, and one of the things he talked about was a study where they had people sit and watch passerby and pick out who they thought looked normal in terms of their weight, and across the board those people they picked as normal were obese. And that's one of the reasons why we need to raise awareness about this issue.
Right, it's become more normalized to have those extra pounds in the weight, but we don't always think about what are the implications that go along with that, because it is so much part of society now. Yeah. So now let's bring it together and talk about the correlation between obesity and breast cancer. How does obesity affect our risk for cancer?
We know there have been studies going back to the 60s and 70s with dietitians that have shown that women with increased body mass index, overweight, obese, have an increased risk of breast cancer. The biggest risk occurs in women who are postmenopausal. A 15-pound weight gain from age 18 into menopause will increase risk. 55-pound can increase as much as 45% the risk of breast cancer. It tends to be hormone-positive breast cancer, but there is a clear association. It's probably related to a number of different factors, things like an enzyme in the excess fatty tissue that helps make more estrogen. Even though you're postmenopausal, your ovaries are no longer making estrogen, you actually can have high levels of estrogen in the system from fatty tissue. It can be related. There's newer research out there about insulin and insulin-like growth factor. Both of these are proliferation type substances, and we know that they start to rise even before you become diagnosed as a type 2 diabetic. There are actually other, what we call kinds in fat, leptin and adiponectin, one of which is proliferative, one of which in normal weight people is higher. The adiponectin is higher in normal weight women and is actually an anti-proliferative. And even just inflammation, chronic excess fat creates a milieu of inflammation, and we know that chronic inflammation can cause DNA changes in cells that can cause cancer. So the goal being, particularly in breast cancer, because as women have figured out, sometimes it's harder to maintain your weight after menopause, it's best that you do.
So just because I don't always understand big words, so you use some words in there that I think would be great to just kind of explain to the audience what that means. So the different types of fatty tissue. I've heard that fat around the middle is one thing that we need to be more concerned about than other parts of the body. So does that kind of contribute to what you were explaining to us?
It does a little bit. A lot of that also has more to do with, cardiovascular health and those kinds of things. But yes, fat around the organs, fat around the middle is always worse than extremity fat. And, you hear the classic, the apple or the pear. If you're an apple, that's worse than a pear. If you carry all your weight around your behind and your thighs, it's still weight. It's still going to contribute to things like insulin and, inflammation, but it isn't going to be as bad as internal fat or fat around the middle that can really cause some other issues.
Gotcha. Thank you. So, if somebody has been diagnosed with breast cancer and they are carrying some extra pounds, is it still recommended that they look at maybe trying to reduce that? Does that help to enhance their treatment and recovery and things of that nature?
Absolutely. It helps in a number of different cancers, not just breast cancer. We know that when we look at survivorship, Overweight and obesity increases the risk of lymphedema, or the swelling of the arm that could occur after breast cancer treatment. We know in prostate patients, it increases the risk of incontinence after prostate surgery. And even in colorectal cancer, it increases the risk of recurrence of rectal cancer. So weight loss absolutely helps. There have been estimates thrown about a 5% reduction in weight can translate into a 12% reduction in the risk of recurrence. Although there's a lot of conflicting studies. There are studies that have suggested that, studies that have not been as conclusive. There is a current study that is still recruiting. It's out by the National Cancer Institute. It's called the Be Well study, BWEL, where they're going to actually compare head-to-head post-diagnosis women, breast cancer diagnosed, who are overweight or obese, and they're going to compare the two groups head-to-head, those that actually go on a program and lose weight versus those that don't, and then look at currents and
That'll be
mortality.
fascinating.
Yeah, great study.
Mm-hmm.
Yeah.
So for those people who might be watching today and thinking, oh my gosh, I need to lose a little weight, what kind of tips can you share that will help us? Because fad diets aren't the answer. We know that, we've talked about that many times, but what is a good way for somebody to kind of get started to reduce their weight and reduce their risk for these diseases?
Well, the first thing I want to, just to take a step back, is to say that when 2/3 of the American public are overweight or obese, we know it's not just a personal issue. It's not just you've got a problem. We've got a problem as a society. And we all know that being overweight is bad for our health, and yet this epidemic continues. And if you want a very shocking visual of it, I've watched it many times. The CDC has a little animation of obesity maps from 1985 to 2010, and it just goes shoo, and you go, oh my gosh.
Right, it shows those little dots
Yes,
as it just
they've had to create
continues
whole
get
new
red,
whole new categories. So if you are trying to lose weight, you are not, and have not been successful, or if you have given up, you are not alone. Yeah. And there's no one reason. The reasons are complex why people gain weight, and there's no one way you're going to lose it. But as a part of this campaign, we've come up with 3 strategies that we want to suggest to you. And the number one is that if you are obese, studies show that it is extremely unlikely you are going to lose weight without help. And a lot of people don't know this. If you've been beating yourself up because you can't lose weight, it's time to seek out a program, look into medical options that can help you manage your weight. You don't have to do it alone. In fact, most studies show you won't be able to do it alone. Right. So get help. The second is that, like you said, it's not about finding the perfect diet. It's about making lifestyle choices that will burn more energy and reduce the amount of fat-forming food that goes in your mouth. And we could do a whole presentation just on that.
Right?
But
all the processed foods,
yes,
and fast
yes,
foods.
yes.
And,
But that's actually what Dr. Simchuk talked about the most, is if you want one simple answer about putting the part into your mouth, eat real food. Eat food that comes from the ground, comes from an animal. That means cut out the processed foods. And the cool thing is that eating real food will help you lose weight, and it's also a cancer-fighting diet, because a lot of studies show that increasing your fruits and vegetable intake is the one diet change that you can make to, lower your risk of getting cancer.
Right. You get all those great nutrients and vitamins and minerals and things that have so many great effects, including helping you to reduce and maintain your weight.
That's hard, because processed food is pushed at us at every turn. You walk into the hardware store and you're being offered an array of junk food. It's not easy.
It's true.
And so the third thing that we are suggesting people try is learn about SMART goals. Many people say, I want to lose weight, I'm going to stop eating carbs, I'm going to exercise 3 times a week, and they do it for a week and then it stops. And what we've learned is that when you write a goal down, when you make it specific, something you can measure whether you've achieved it or not, something that is attainable, so we want to be super realistic with these goals, something that's relevant to you, so you're writing down why it's important, and you make it time bound, you give yourself a deadline. These SMART goals will help you to actually achieve success that you can then build upon. And I would suggest that your first SMART goal be about finding resources to help lose weight.
Having that network and the support and the encouragement, because it can be very daunting. And those, I like how you said those small little tangible things, don't try to do it all at once. You know, we talk about that with New Year's resolutions, right? We're like, oh, I'm going to get in shape this year. Well, define that.
Yes.
And that's what the SMART goal will really help, is to define those steps that will lead to that lifestyle change and success. So.
I don't think people know there are programs in our community that are available to help. This is a community problem, and there are a lot of community organizations.
Right, and we're gonna provide some of those in that resource sheet that I mentioned.
Yes.
So you know, you don't have to go seek them out. We're gonna just give them to you and help to start your success path right off
The
on the right
county,
foot.
the university are providing no cost, and there's low cost. Weight Watchers is a whole new. It's not my mom's Weight Watchers. There's online options that cost as little as $5 a month. It's like. Yeah,
And even just getting together a little support group of your own. I think if you engage your friends and your family, that could be your first step. And then, start getting those habits in place, and then take it to a program like that that really takes it to the next level. So there's a lot of ways that you can get the support, but don't try to keep it all to yourself. So we've had some great information. Breast cancer, obesity, SMART goals. Anything else that you would like to share with our audience today?
Just to remember that to be kind to yourself. This isn't a crash diet. This isn't losing 20 pounds in a month.
Right.
This is picking a goal you can reach. Everybody gets frustrated if you can't meet a goal. If it's 1 pound in a month, meet that first goal and go, well, look how easy that was, and move on. Think about those specific things that you can do. Whether it is cutting out one thing in your diet that you know is bad for you, whether it's eating off of a smaller plate, just do it kindly and don't deprive yourself.
Trading that one soda for a glass of water. It's a step in the right direction.
And I think, just remembering that the American Institute for Cancer Research, the Centers for Disease Control, are making this message loud and clear. The most important thing you can do, other than quitting smoking to reduce your risk of cancer, is take off some weight.
Yeah, that's pretty powerful when you put it in terms like that. So super, super important. So thank you both very much for being here and for sharing this information with our audience. Thank you everybody for joining us today. And we will continue to have this video available in the video section. So if you didn't get a chance to watch the whole thing or want to refer back, please feel free to do so. And just a reminder, in the comments there will be the link to the survey. We would really appreciate any feedback that you can give. And that resource sheet is going to be there, so you can find some really great resources to help you in your weight loss journey. Next month, we're going to be back here talking about a different kind of cancer. We'll be with Dr. Keith Cavanis talking about pancreatic cancer, which is one of the most challenging cancer types that some folks deal with. And so we look forward to seeing you then. It'll be November 8th at noon. And between now and then, have a really great day. Thanks so much.